And
Hi, everyone. We did our IT group project on an application called Clinic NursOne. I'm Adina. We have Danielle, Sarah, and Tassos. So Clinic NursOne application. We came up with this application that will allow individuals to see the entire hospital's nursing staff logistics through the Cleveland Clinic. This program is driven towards establishing an accessible catalog of nursing experience, certifications, skill set, and level of education to help in times of staffing crisis. This software will modernize staffing processes and improve efficiency by including these licenses, certifications, and level of education. Nurses are constantly asked to float, and this causes a lot of anxiety and frustration. In times of uncertainty, such as natural disasters or pandemics, or staffing shortages, having one main place to go to for information to guide nursing reassignment would be very beneficial. Clinic NursOne will increase job satisfaction, effectiveness of the job, and will eliminate paper, making it very eco-friendly. Why Clinic NursOne application? So traditional spreadsheets with similar information have been stored on individual units, preventing quick decision-making in times of emergency. By placing this information in electronic form, crucial information can be quickly obtained and distributed throughout the organization. This will provide needed support with critical decision-making rather than having paper spreadsheets sent from one person to another. The app's goal is to prevent errors from happening during major catastrophes and when coverage is weak in certain areas of the department. The app will look at creating innovative ways to making practices and procedures more streamlined. So an example of this, this would help tremendously during a pandemic when everyone is frantically floating and not familiar with the specific unit that they are expected to float in. And then here we have some Cleveland Clinic history. We chose the Cleveland Clinic because it has been named the second hospital in the nation and #1 hospital for heart. And we believe that this application would strive here. The Cleveland Clinic started in 1921 when 4 Cleveland doctors established the Cleveland Clinic Foundation. Their names were George W. Kreidel, Frank E. Bunce, William E. Lauer, and John Phillip. So they had a vision to create a hospital where medical experts would work together as a team while investing in medical research and education. So they made their vision come to life in 1924 when the building of the new hospital began. And then here to the right, we have the pictures of them. Cleveland Clinic history continued. In May 1929, the Cleveland Clinic faced a major setback due to a fire that started in the basement of the hospital and was caused by nitrocellulose X-ray film that ignited when a exposed light bulb came too close to the film. So thankfully, the Cleveland Clinic survived this tragedy and continued to grow while gaining reputation for its advancements in medical research and treatment in the decades following the World War II. In their first century, Cleveland Clinic introduced many medical firsts. So they opened up facilities around the world and is now and is proud to be ranked among the top hospitals in the country. Today, the vision of the founders remains the same. So Cleveland Clinic's mission is caring for life, researching for health, and educating those who serve. And now, 100 years later, Cleveland Clinic is shining brighter than ever before.
all right, thank you, Adina. I'm going to talk about the IT audit that we conducted at the Cleveland Clinic. So after completing the IT audit, we noticed a lot of gaps in documentation being needed. The clinic is a very large organization and their IT system is very solid, but if something does happen, where's this documentation kept? How do you find this information? And as you can see on the screen, I have highlighted a few things that we found in the audit showing that it needed formal documentation. And on the next slide, there's even more examples of how there's no specific documentation needed. So although the audit we completed was not geared towards nursing, because we decided on an issue before the audit, we proposed our idea to leverage nurses with modern technology. With the clinic being so large, conducting a more generalized IT audit was more manageable to complete. And then after completing the audit, we thought if there's documentation missing in general for all these instances, how can we create an application for nurses that can have all their scheduling needs and other information in one central location? They have so much on their plate. They're worrying about finding their schedule, the unit information, floating, and other employee information. So where are those documents kept? In such a large organization, they're kept all over the place. So we decided, how can we fix that? So that's why we decided on the Clinic NursOne application. Now, Sarah will get into the clinical staffing needs and issues that were identified when we were writing our proposal a little later, and kind of help you understand why the clinic would benefit from this app. So this application will be a SaaS, also known as software as service-based development, which holds many benefits. SaaS-based mobile app helps enterprises reduce the burden of holding their on-site IT and dedicated staff to operate it and spending money on its maintenance. So with an organization so large, sometimes it's hard to get a hold of IT in real-time issues. So if you can't get a hold of IT and you want to find the information and you can't find that documentation and you're looking for it, it comes back to the lack of documentation. So why not have an app that can have all that into one central location? So the app will be easy and convenient to use for nurse managers, nurses, and the administrators. Although it will be mainly used for staffing nurses and nurse managers, it still will be very beneficial for administrators for data and pulling numbers. Now, as you can see on the screen, it's a little bit of a prototype of what we are looking at, what we'd like to do with this application. It's very similar to the app NurseGrid, which we used a couple of their photos for just to show the sense of idea what we need, what we are looking for. Each login will have a two-part authentication process, and you'll have to request access. So we are not application creators, but our idea of this app is shown here. And like I said, it would be similar to the NurseGrid application. We would like to add more tabs, such as the policies, the unit information, and the data, as you can see on the last image. Having somebody develop this SaaS-based mobile application would provide the clinic with many benefits, such as automatic updates, high-level data security, easy accessibility. It will integrate with the existing software, such as Epic, that the clinic uses. And it will be scalable, and it will have real-time project access. So there is a lot of benefits that Cleveland Clinic would benefit from with this Clinic NursOne app. So Sarah will now talk about the clinic issues and healthcare organizations and the issues that healthcare organizations are currently going through, and why this application will help. She will also discuss a few of the risks that are associated with using this application.
Thank you, Danielle. So we're going to take a deeper look at more of the clinical issue that we identified. So nursing is a critical factor in determining quality of care and accounts for the patient's overall outcome. So going a step further, as nursing is critical for positive outcomes, hospitals are considered central to the overall healthcare system. So to ensure that nursing provides for the best possible patient outcome, it is imperative for staff nurses to be successful. So staffing to provide safe, effective, and therapeutic patient care is a challenge for nurse administrators under any circumstances, but it significantly increases as we go through a pandemic or a staff shortage or any crisis going on outside of the hospital. So we look at whether staff shortages are either temporary or long-term. It's important that organizations such as the Cleveland Clinic gives this issue the attention that is necessary and it provides for better patient outcomes. So hospitals with low nurse staffing levels tend to have higher rates of poor patient outcomes. Examples of this are pneumonia, shock, cardiac arrest, and urinary tract infections. These are complications that are not only taxing on patients and staff, but they pose a detrimental consequence to the hospital system in general. This is very expensive and it can really tax on the clinic's reputation. So staffing shortages can be caused by both internal and external factors. For an example, internal factors could be salary issues, long hours, increased responsibilities faced by the nurses, burnout and turnover. And then shifting to like examples of the external factors, as we can see very obvious now is the global pandemic, COVID-19. Any natural disasters such as hurricanes or earthquakes have impacted hospital systems. Medical illness, again, going back to COVID-19, not only are the patients getting sick, but also medical staff, which can cause extreme shortages on specific units. And then finally, with family emergencies. So as staff experience emergencies in their own family, they miss work, which overall shorts the staff on each unit. So these are just a couple key examples that can cause staffing shortages. To continue to highlight critical staffing, in times of medical crisis or state of emergency, it's imperative to have the correct staff in the correct places to ensure the best outcomes. Benefits of appropriate staffing include better staffing equals more reimbursement. So the better you're staffed, the more you can charge the patient or insurances to reimburse the system. More nurses also ensures fresher nurses, and it promotes critical thinking and problem solving, and it overall provides for a decreased patient mortality rate. We thought that Clinic NursOne would benefit the hospital system. We thought that it would form an organized and detailed system cataloging nurse experience, expertise, and certifications, which eases the workload of management during this time of necessity. It also expedites the process of providing the best experienced staff to the appropriate areas of need. So this kind of touches on anybody who has ICU experience would be first floated to the ICU as they have the most experience and they can provide the most appropriate patient care. For somebody who's only worked in med surg or maybe even mom and baby units, they wouldn't necessarily be prepared for an ICU experience. Being displaced from what is familiar and routine and working with fewer staff than required for functioning in times of chaos only creates fear and uncertainty, which leads to conflict. So without addressing this, staff morale decreases and nursing burnout flourishes, and overall staff retention plummets. So all of these are really bad scenarios for the hospital. And with the implementation of Clinic NursOne, we feel like we could aid in avoiding these crises. And then finally, this software will modernize staffing processes and improve efficiency by including licenses, certifications, schedules, and skills. So having one standard application would assist in staffing, floating, and emergency situations more efficiently. So shifting gears, we also did a risk analysis, and we were able to identify 6 potential risks of implementing Clinic NursOne. And we were able to actually break this down into 2 categories. We looked at internal risks as well as external risks. So the internal risks, we identified unauthorized users, and then PHI disclosure, so disclosure of personal health information, and the misuse of authorized privilege. And then the external risks we identified as program errors, hacking or tampering of the application, and then vendor behavior. We looked at this, and when we broke it down into the 2 categories, it was very obvious that the external risks are much harder to deal with, as it's harder to monitor anything that is outside the limits of the company or the organization. So when we identified the potential risks, we also wanted to add recommendations on how to fix these risks or how to avoid the most harm. So some things we came up with, we recommend that they establish formal access. We wanted to limit the personnel that were given privileges. The fewer people that are having the access to add information or change information is limited. That way that people aren't misusing their power. We also recommended to maintain audit trails. So that way you can see what is actually happening in the app. You can see who added what and at what time or who took away to try and track down anything that would have been not the correct application of the unit. Also, we looked at password security. Like Danielle had mentioned earlier, we recommend two-part authorization processes. We recommend secure backups and storage, and to have a recovery plan in case the application would crash. They would be able to recover the information added into it. Also, we wanted to recommend and put a strong emphasis on user education. It's always good to educate the user on the ins and outs of the system and how it can truly benefit the organization to get the most use out of the application. We recommend open communication routes with vendors. And then overall, we just want to create a better system to help the organization. At this time, I'm going to turn it over to Tassos to continue our presentation and guide you through the budgetary considerations, limitations, and feasibility.
Thank you, Sarah. So looking at budgetary considerations, limitations, and feasibility. According to the National Healthcare Retention RN Staffing Survey, the average cost of turnover for bedside RN is $52,100 and ranges from $40,300 to $64,000. The average hospital loses $4.4 million to $6.9 million with these yearly costs. According to a benchmark report from SHRM, the average cost per hire across organizations and industries is $4,125. These onboarding costs can include, but are not limited to the following: laptops and phones to complete work, any training resources and time investments from HR and IT. So let's look at flexibility and staffing. The importance of having flexible staffing with adjunct to the baseline staffing was most effective at avoiding understaffing when high numbers of permanent staff were employed. Utilizing your own staff, you will save time and money in having to outsource nurses that may not be as experienced or educated with certain situations. The limitations of this application is that flexible staffing does not effectively cut the costs incurred with a smaller hospital. When having an application implemented into daily work practice, this will allow managers to utilize current staff that are adequately trained rather than having to outsource and spend extra time and money in the process. Streamlining and application structure. Here, the staff will have the opportunity to create a work platform that is more structured and cohesive, as well as providing workers that are effective and productive in completing their tasks. This will also improve the fluidity of the day-to-day work and will increase the outcomes of the day-to-day operations. Clinic NursOne is designed to reduce the stress of the organization in finding staff that is adequately trained to perform specific job tasks per catalog search for an appropriately trained nurse already staffed by the hospital. This will also create a work environment that is more welcoming, which will lead to higher employee satisfaction. So let's look at alternatives and disadvantages. An alternative to using an application is to hire agency nurses. The advantage is here that it creates a work environment that's more welcoming, which will lead to higher employee satisfaction. The disadvantages is that the availability can be varied. Covering at short notice, here we show was between 5% and 45%, depending on the time of the day and staff. When hired, these individuals may or not be able to meet the demand of the hospital. And also full-time staff may not be able to fill the request due to the busy schedule. Also, it's important to note that filling a shift does not mean it is always a positive healthcare outcome. So looking at the importance of Clinic NursOne, we need to remember this will lower the numbers of permanent staff, but there will be problems such as maintaining your quality of care and risking the lives of your patients. By utilizing your own staff, there will be some positive things, which will save time and money in having to outsource nurses that may not be as experienced or educated with certain situations as the staff that you already may have. This will also prevent the risk of having an error happen, which could be detrimental to your organization. And it also is very, very important that this will save thousands of dollars of not outsourcing to outside agencies. Need to remember Clinic NursOne will improve on the quality of care, and it will be more focused on providing the care that the patient deserves. I'd like to thank all of you for joining us this evening with our presentation. We'd like to wish each and every one of you a great end to the semester and a great start to the spring semester too. Thank you so much.
Sorry, guys. Trying to stop sharing it.